Both my parents were physicians. My dad was an internal medicine physician, and my mother was an anesthesiologist in a small town in southwest Michigan. And that gave me the insight to the joy and value of being a physician and taking care of people. And I also liked using my hands, and surgery was exciting to me. And after dabbling in different fields in medical school, I chose orthopedics. Some people are referred and they've been living it with pain for a while and they just had enough. It's a scary thought for a lot of people to have surgery, and so a lot of people put it off. I was one of the first people in Cleveland to champion the anterior approach, which is a muscle-sparing, minimally invasive way to do hip replacement. Over 90% of my patients go home as an outpatient, and virtually all patients, their expectations are exceeded by their recovery progress and how back they are to living life, back to work, and how little pain they have after surgery. Don't forget, it's still a major operation. There's still some pain, but compared to what they expect, it's a lot better, and it's universally a wonderful procedure in terms of getting people back to living life. In addition to the anterior approach, I do general orthopedics as well. I have a lot of sports medicine experience, so I do rotator cuff repairs, sports injuries, knee replacements, fracture care, as well as carpal tunnel, and essentially every orthopedic condition aside from spine. I've been in Cleveland since 2006. I love Northeast Ohio. I love spending time with my family, and I love college sports.